Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome to everybody joining us here today. We are right around the corner from our Gold Lactation 2025 online conference, and I can't wait to see you all there. There is still time to register, so you can head over to the website right now at goldlactation.com. Super easy. Head over there, register for this entire event, and you will be fortunate enough to see my guest who's sitting in front of us today, Dr. Angela Lober. So great to have you here, Angela. Thank you for joining me here today.
Hi, thank you for having me. I'm so excited.
Yeah, absolutely. And of course, I do have a surprise for everyone. If you're wanting to come and see just Angela, you can register right now because your presentation is going to be free and open access. How cool is that? Because I always say that because it just means the message can get so much further, right, Angela?
Oh, so true. I'm very excited that anybody can see this because late preterm infants, they get lost in our shuffle. So if we can do a
Right.
better job across the profession, that would be
That's
amazing.
right. That's right. That's right. So Angela's going to be talking about nurturing late preterm infants, feeding strategies, and family support. Now, here we are talking about this. This is something that you actually specialized in. We've been talking about it with our participants for a few weeks with the lead up to the conference and sharing all the great things that you've been doing, Angela. But I was thinking about this topic again, and this is still a thing. This is what frustrates me.
Yes,
Because
agreed.
I was going to say, okay, we need to sit down and talk about this, and it is true. It's still a thing. These babies are being born, in fact, more frequently, I would say now than ever. You would agree with that, right?
Right, and the research shows that. So we've
Yeah,
been able to decrease the number of moderate to very early preterm births, but the group of late preterm is growing quite substantially. So it would, yeah, it's becoming
yeah.
a very important issue. More
Yeah,
so than,
absolutely.
yeah.
Yeah. And I had someone call me just the other day, and this baby was late preterm, and and again, it was an induced birth, shocked that this baby was not nursing. They were so
Yeah.
surprised because it was a big size baby, and this throws people
Hmm.
off all the time. It seems to be that, the bigger the size baby, the more they equate it to ability, right? You've probably seen that before too.
100%. That's how I even got into this field of research, is because they especially if the parent is diabetic, then you
Right.
get like 8, 9, even a 9 pound 36
Right.
weeker.
Yeah.
And and they don't, they look great. They are physiologically stable enough usually, like maybe
Sure.
some jaundice and hypoglycemia, but otherwise stable, is stable enough to go home. And
Yeah.
then they don't do well once they get home. And
No.
so we really need to reframe how we're teaching families with late preterm
Yeah.
infants.
And I think what we know more about the whole family now too is that if with some of these parents, like you said, gestational diabetes, we do have quite a few late preterm inductions as well for
Mhm.
various reasons. It would be then that the pregnant person, the mother, they have also gone through quite a lot, in that time as well. So you've actually got this two-factor and trifactor because you've got the other parent that's usually engaged and involved as well. The families have
Mhm.
usually gone through a lot. When you sit with a family that have a late preterm infant, it is not like it's not clean cut. There's a lot of layers to it.
So many layers, and sadly they're getting different advice from different practitioners. So they
Right.
might hear, um, just as a kind of a backstory, I was a labor and delivery nurse. And so 25 years ago, when I started off, when a baby was born at 36 weeks, we were all saying, "Oh, this is great. Your baby is term enough." Right. And
Right.
then, and so, and then the baby is born, and in labor and delivery, the baby eats beautifully. They come out fully awake and all of their reflexes charged up. And so
Yeah.
what we weren't seeing, what I didn't see until I became a lactation consultant, was in postpartum, everything changes. So in
Hmm.
labor and delivery, they're getting this feedback from the nurses and the doctors or whatever, like your baby's doing so great. And then
Right.
the later that day, the next day, the baby's exhausted and starting to show their prematurity. And that's very frustrating for families because they want something that's kind of straightforward. cut and dry. Like this is what to expect. They want a linear progression to the feeding. So
Keep
every
going
feeding,
up, right?
yeah, every feeding gets better and better. And that is not how this group operates at all. Like you
Yeah,
might have a great feeding, but then not again until tomorrow or the next day or whenever. So
yeah.
we need to set proper expectations for the families for sure and all of those of us who touch those lives.
Yeah. Yeah, I'm thinking about that whole family and how much they go through in that first 48 hours. And if things are not linear, like you said, it's the sort of, you have to sort of expect the unexpected.
Mhm.
And I've seen it over and over again. My frustration, as you mentioned, is some of the fact that we still are getting no we're actually getting a lot of old advice as well. So, some of the
Mhm.
terms that you just use, like they're what did you say it was called? They're
Term
good enough?
enough.
Term enough, yeah.
Yeah.
And I think that, there is this sort of, "Oh, well, they are term, so they should be fine." You can have a
Yeah,
baby between, 37 plus weeks and, and everything is good. These late preterms, they're a little bit earlier, 35, 34 to 36 weeks. Um, and just like you probably seen it, just like our viewers listening in, I've had plenty of a 35 weekers, that I anticipate that things are not going to go well and they're a little scrawny looking, not so big, and they go home the next day and they're fine.
they're
And so
fine.
there's no real rhyme or reason. Now, I wouldn't just pass that family off, of course, because I'm sensitive to the fact that there's still that late preterm. But I think it is. We really need a criteria of making sure that they're getting adequate, consistent follow up, and that they don't fall through the cracks, which is still happening to this day, right?
For sure. Every baby is their own individual. Every baby will act as they want as they have the skill set and the stability to do it. So it is incredibly difficult to make these blanket kind of recommendations. Well, your baby is 36 or 35, and so we do these things. We put them on triple feeding plans out of the gate,
Right.
and I'm going to spend a lot of time discussing that about.
Oh,
I'm
good.
trying to start a revolution where we
Yeah.
stop saying triple feeding. It's
Oh,
overwhelming. Families hate it. It's
right.
and I like to call it supportive feeding. So in the moment, this feeding, what does the baby need? What does
Right.
the mom need, the parent need? Maybe pumping and bottle feeding and breastfeeding, this feeding is too much and they're hitting a
Yeah.
wall and they need to stop. So, rather than making life-changing decisions in a bad moment, like let's just talk about this feeding. And so I've started using the phrasing of supportive feeding.
Hmm.
But yeah, we have to be able to allow the infants of all gestations to really show who they are and show their skill set and what they need from us as their support providers. So we'll talk a lot about that.
I'm very excited
Yeah.
about that too. I think that, having a really good deep dive into this, and as part of our keynote, which is really exciting, you will be speaking for, 75 minutes there,
Yeah.
as well as a live Q&A. You'll be speaking twice on the day, which is absolutely fantastic. You're a
Mhm.
speaker on April 1st for most people around the world. But they'll need to head over to the website and check out all the details, as you and I live in different time zones for most of the year,
Yeah.
some of the year. But everyone else listening in, I know that you're coming in and coming in from different parts of the world, which is really exciting. Angela, before I let you go, this topic, you have been a scholar of this topic for many, many years. Does it surprise you that, it is still evolving in some ways, that you feel like you in fact in the topic itself, you have to take it back to move it forward, two steps back, one step forward?
For sure. Yes. It's we don't do enough research. I would love for more
Right.
people to do the research rather than passing on the recommendations and guidelines that maybe are getting outdated. Just always, we need more people doing research. But I did my PhD on late
Yeah.
preterm infants and their feeding challenges. That was in 2018, and I feel like we're still having the same conversations.
Right.
And another big thing that I really love to talk about is that there's no light switch at 37 and 0. Like the minute we think the baby turns 37 weeks.
Yeah.
It's not like they're saying, "Oh, okay, I'm term now. I can handle
Yeah,
all of this." If the dates are off on the pregnancy, if like, if this one baby isn't ready to be term, so we have to look at 37 too. And I always encourage people to just look at that time frame, the
absolutely.
35 through 37, and then we can make more appropriate care plans.
Yeah, absolutely. Well, I'm looking forward to hearing some of the updates, what you've discovered over this last little while, in terms of things of how we can really improve this area. Like we said, we know that the number of these infants is actually increasing, which means that our skills have to be even
Mm,
sharper.
mhm.
So I'll look forward to seeing you online. Thank you so much to Dr. Angela Lober for
Thank
joining me
you.
here today. And to all of our viewers tuning in, don't forget to head over to the website goldlactation.com. You can register for Angela's event, so absolutely free, no strings attached. You just need to register, make sure you grab your seat. If you can't make it to the live day, then you'll be able to watch the recorded event as well. But we'll look forward to seeing you all online. Thank you again, Angela, for being with us
Thank
here
you.
today, and we'll see you all very soon. Bye bye for now, everyone.